Hi, this is Dr. Matthew Dunn. I wanted to make a quick presentation for the website because we've been doing a lot of new treatments with this peripheral neuropathy and we get a lot of questions from patients about it. So here we go. First, who am I? I'm Dr. Matthew Dunn. I have a private practice in Peachtree City, Georgia. I'm a member of the Neuropathy Treatment Centers of America, and just recently I was listed in the 2012 issue, the Top Doctors issue for Lifestyle magazine, in the spine and neuropathy category. So I'm pretty proud of that. Well, let's get right into it quickly. So what is peripheral neuropathy? Neuropathy just means that there's damage to the small nerves in the hands and feet. Typically the feet are going to be affected first and the hands later. Patients will often tell me that they're experiencing a burning, tingling, numb sensation. Sometimes they'll even talk about bugs. Feels like there's bugs crawling on their legs. They sometimes will feel hot, sometimes will feel cold, sometimes both at the same time. Restless leg syndrome is a function of neuropathy as well. Neuropathy causes restless leg syndrome. So the big problems with peripheral neuropathy, the number one thing that we're concerned about is balance issues. When you start getting damage to the nerves that surround the ankles, your brain does not know where your feet are at in space. And as we know, falls are the number one cause of death above age 65. So that's a big concern for our neuropathy patients. The second thing I always look at is the lack of sensation in the feet. Patients will tell me that they're unable to feel the pressure of the brake pedal or the gas pedal. That can make it very difficult and unsafe for them to drive. Patients also tell me that they have a lot of trouble feeling hot and cold. So getting into a hot bath or shower can be a challenge and can be dangerous. And one of the big things with diabetics with that neuropathy is they can't feel damage to the skin in their feet. So if they step on a pebble and it starts eroding the skin, that can get infected. And because of the lack of nerve sensation and circulation to the foot, it can often lead to amputation of the toes or the foot. So those are some of the big concerns with peripheral neuropathy. So if we look at how the nervous system is structured in the body, your spinal cord comes out of your brain, and the nerves that branch off from the spinal cord go to every cell, organ, and tissue in your body, from your neck all the way down to your hands, and from your low back all the way down to your feet. Now, when those nerves get towards the skin, if we take a closer look at a picture of the skin here, you'll see the top of the skin cell. If you look how it's very red near the surface, that's blood near the surface. If you look on the right side, you can see the large nerve come up. When it gets to the top epidermis layer, it branches out and becomes a sensory nerve ending, or a small fiber nerve. That's what gives you the tactile sensation in your hands and feet. Now, again, you'll notice that top red layer. When circulation gets poor in that area due to many cardiovascular issues, those nerves, those small sensory nerve endings that are floating around in that blood in the epidermis, get starved for oxygen and nutrients, and they start to peel back and die off. That's the beginning of what's called a small fiber peripheral neuropathy, and that's what's typically going to give you that burning sensation, those pain sensations. Now, as the damage progresses, it progresses further down that nerve, and when you start getting damage to those large fibers, that's when you start losing more. You get more of the numbness, you start losing reflexes and things like that. When it starts progressing to that area, it becomes a very dangerous condition. So we try to catch it early in the process. The earlier we catch it in the process, the more that can be done to treat it. Now, what causes the damage to those nerves? The number one cause is diabetes. The problem with diabetes is when your blood sugar is constantly going on a roller coaster, the small vessels that feed that epidermis layer, like I showed you with the blood flow, those get clogged up, and that excess sugar in the blood is actually toxic to those nerve endings. It just fries them right off. Another thing that causes damage is chemotherapy. Those drugs that kill the cancer cells also kill a lot of other things in the body. One of the real easy things to attack is those small fiber nerves. The next issue is low back issues like sciatica or stenosis. People that have had lumbar surgeries tend to get a lot of neuropathy. I think of an analogy like a garden hose. If you pinch off a garden hose, it's going to diminish the flow at the end of that hose. Well, if you think of the nerves going down the leg, the sciatic nerve, like a garden hose, if you pinch the garden hose at the low back, it's going to diminish flow at the very distal portion, which is the feet. Another thing that can cause problems is long-term use of cholesterol-lowering drugs, Lipitor, Crestor, Simvastatin, any kind of statin class of drugs, even the fenofibrate medications can cause some problems. And the reason that is all your nerves in your body are sheathed in cholesterol. Just like an electric wire, in your house, it uses that plastic around the wire to protect it. If you were to strip that plastic off, you would have sparks and a lot of problems. Well, the cholesterol around the nerves is like that sheathing on the electric wire. When you take cholesterol, you take that pill into your body, it doesn't know to only take cholesterol from your GI tract. It starts pulling cholesterol systemically. It pulls it everywhere. One of the real easy places for it to strip off the cholesterol from is those small fiber nerves in the hands and feet. They're very, small, they're weak, they're not protected. So over time it will strip off the cholesterol there. And much like the electric wire with the sparks, you'll start getting a lot of sensations. There's also some genetic components that can cause neuropathy, but typically we see it mostly caused with lifestyle factors like the low back issues, like the diabetes, like the cholesterol drugs. Okay. Now, the medical treatment for peripheral neuropathy has been the same for a long time, and that's drug therapy. Most of the patients that come to us are already on gabapentin, which is the generic name for Neurontin, Lyrica, or maybe called pregabalin, Cymbalta, Topamax. And what these are anticonvulsant medications. These are actually for seizures. And these really do nothing to physiologically affect the feet. They only block the pain signals in the brain. So even though the problem is damage to the nerves in the hands and feet, the traditional medical approach is just to block the symptomatology, which can lead to a better quality of life, but long term that nerve degenerative process of neuropathy just keeps progressing, and these drugs don't do anything to target the problem. So what I wanted to talk a little bit more about today is some new research that's coming out, and we'll talk about that in a second. One of the other big problems is with the diagnosis of peripheral neuropathy. So most of the patients that come to me have already been to their neurologist, and they've had a NCV, which is nerve conduction velocity, or a needle EMG study. And those are typically tests that are going to be used by the neurologist to test the structure of the nerves. These tend to be very effective for the large fibers, the big nerves going down the legs, but they miss components of small fiber neuropathy because those nerves are so small, these tests just aren't sensitive to them. And I guess the frustrating thing is, even with a proper diagnosis of, say a small fiber neuropathy, the medical treatment protocol is completely symptom based. So, most of the doctors are going to say, well, it's just something you have to live with. In 5 or 10 years ago, that may have been the case, but there is a lot of research coming out, new things that are coming down the pike that are allowing us to pretty effectively treat these type of conditions, and we'll talk a little bit more about that. So there's a new treatment protocol that we're utilizing. It's a multi-therapy approach. There's no cookie cutter approach that's perfect for everybody, but it is a non-drug, non-surgical approach, and it actually treats the underlying cause, meaning it helps the circulation, like I showed you at the top of the skin, and it stimulates small fiber nerve growth. This treatment protocol was developed by the Neuropathy Treatment Centers of America, which is a group that I'm a member of, and it utilizes safe, FDA-cleared technology in its treatment protocol, so it's not anything kind of crazy. However, it's not for everybody. Not every person is a good candidate. If their nerve damage is too extensive, or if there's actually damage to the large fiber nerves, then that patient really isn't going to be a good candidate for the non-drug, non-surgical approach. But we are finding that a large percentage of patients do fall within a range that we are able to treat effectively. So in order to analyze these things, we've come up with something that we learned is called the Advanced Neurofoot Analysis. It's a 74-point goal-driven screening tool that's been research validated, and this helps us determine if a patient is going to be amenable to the type of treatment that we provide. So we run the 74-point screening tool, which takes a little while. Patients give us sensations. We test all the large and small fiber nerves, reflexes. We test a bunch of different things. All that data is fed into a computer, and it gives us an initial lab report that looks something like this. Now, you see I had to block out some personal information on this particular patient. But if you look at this patient, the patient had 48.8% sensory loss in their right leg and 52.5% sensory loss in their left leg. I should have left the date on here. Once we run them through our treatment protocols over the course of several weeks, much like a physical therapy type approach, This is a progress lab report, so we retest and we rescore everything. And you can see in this, oh, I did leave the dates on this one. So this is February 6, 2012 to March 2nd. I don't know why that says 2010, but it should be 2012. So this is about a month worth of treatment. And you can see this patient improved about 20% on the right leg and looks like another 17% on the left leg. So that's pretty significant improvement over 1 month, and I don't know which particular patient this was, but I would venture to say that they probably weren't done with treatment at this point. But what this research validated neurofoot analysis allows us to do is quantify the amount of nerve damage. So not only do we know what type of nerves are damaged, are they the large fiber, are they the small fiber, but we know to what extent they're damaged, and we can objectify improvements and show improvements with our treatment protocols. Okay, so it's pretty exciting stuff that we've been able to do. Just want to put my contact information in here. Again, my name is Dr. Matthew Dunn. I'm practicing Peachtree City, Georgia. Got my phone number and email there if you want to contact me. If you have any questions or if there's anything I can help you with, feel free to contact me, and I'll try to provide you any information that I can. All right, thank you. Have a good night.